Good afternoon, my name is Michelle Brown, and today we are going to be showing how to do blood administration here at Skills Day for all the Med-Surg ER and surgical nurses here at Valley Care. So I'm going to walk you through the process of how our policy and procedure states to administer blood and other blood products. So the first thing that you do is you obtain an order. You get an order from the phone. You need to make sure that the doctor has talked to the patient or the family or whoever will be consenting for the blood administration. So once you get an order, you fill out the blood order form, which is right here, and I have provided an attachment as well for you to see closer. But this is our blood administration form. You fill this out, you send the order to the lab, and you also make sure that the patient or the patient's family signs the consent. If the patient isn't able to sign for themselves, then you need to call family, or if family is around, have them sign and make sure that they're okay with the patient getting blood. Once that is signed, you call the lab and say, hey, I'm ready to get the blood, call me when it's ready. So you set up everything in the room, you make sure that they have an 18 or 20 gauge IV and that it's good. You set up only normal saline that goes with blood. You set up the correct tubing. You get that all ready. You want to take their vital signs, make sure those are all stable prior to going to get the blood, because if you have a temperature before you start the blood, you want to be able to deal with that prior, let the doctor know about it, see if he still wants to give the blood even if they have a temperature, and then go from there. So say the vitals are stable and now the blood bank has called and said that the blood is ready. I go down to the blood bank with the blood order form right here, and we go over the form with the blood, and we make sure that it's the correct patient, the correct date of birth, the correct medical record number and correct unit number, and that it has not expired. And then you come back with your unit of blood and your infusion flow sheet, which has the signatures of who you're verifying it with and the times that you're going to do the vital signs. Great. So you have your blood and you have your flow sheet, and you go back to your patient with another nurse. 2 nurses have to be present to verify the blood, and one person has the paper in hand, one person has the blood in hand, and you're both looking at the ID of the patient. So you say, hi, my name is Michelle, I'm your nurse today. I'm going to be giving you some blood. I know the doctor talked to you about this and we've signed the consent. We've gotten it all ready. Vital signs are stable. This is Rico Suave, med rec number, such and such, date of birth. You go through your whole spiel. Both nurses need to look at the med flow sheet, the blood flow sheet, excuse me, and the blood and the ID of the patient. It's really important that both nurses are looking at both the blood bag and the list of the blood order and the ID band. Then once we have that all co-signed and started, we stay with the patient the first 15 minutes. If there's a reaction that's going to occur, it's going to occur in the first 15 minutes. So our protocol here at Valley Care states that if you're suspecting a febrile reaction, say they're getting flushed, they're really red and hot and they have a fever, you're going to stop that transfusion right away and you're going to call the doctor. Even if you already have an order for as needed Tylenol, you're going to call the doctor. They might want Tylenol or Benadryl and to continue to give the blood transfusion. It's really up to them. They may say stop the transfusion altogether. Okay, so say we have a different scenario that we are suspecting an anaphylactic reaction. Chest pain, shortness of breath, swelling in the face, hives, every bad scenario that you could think of goes wrong, and blood pressure is starting to tank and her respirations are going up. We're going to stop that infusion right away. We're going to call for our fellow nurses for support, and if we think of our ABCs and we go through that protocol, we are thinking about getting the blood reaction form and filling that out because we're having a counter reaction, and we're also calling the doctor to let him know what's going on and getting further orders from there. After that, we are stopping the blood has already been stopped. We are then going to disconnect all the way up to the hub of the patient. You don't have to take out the IV, but the saline lock that is connected to the patient needs to be removed because that is filled with blood. All of that is going to go back to blood bank, and you're going to start a new saline lock and connect that with a new bag of normal saline and run that into the patient, making sure that patient safety is always your #1 concern, so you're following the doctor's orders that you got after that reaction has occurred and taking care of the patient from there. Okay, now that we have gone through the worst case scenarios that happen with blood, a couple reminders are to make sure that the nurses are the ones doing the vital signs. We stay in the room again for the first 15 minutes so that we are sure that the patient is safe and tolerating well. After the first 15 minutes, we're going to get vital signs then, and then every hour after that. And then we are also getting vitals immediately when the blood product is done, and we are documenting all of that. We document the start time, 15 minutes after, and every hour after that on the hour. We're not having CNAs or aides check the vital signs because we're not just assessing the numbers, we're assessing the entire patient. So it's really important that the nurses are the ones that go into the patient's room and check on them. At the very least, every hour, if not more. Another thing I want to stress to the nurses is that sometimes we get orders to transfuse with dialysis. Our role as the nurse taking care of this patient is to educate the dialysis nurse on our policy and procedure on how we fill out the vital signs and how often we need to do them. We also need to make sure the consent was done and the patient got the education from the doctor and that the nurse talked to them as well, okay? And then the dialysis nurse can take care of the vital signs. So, in reviewing the blood tubing, I just want to go over that. We have a couple different types of tubing. At Valley Care, our platelet tubing comes in this box. I'd like to review that platelet tubing never goes on a pump, and like all blood products, you start slow and then you go as fast as they can tolerate. So with this platelet tubing, you'll see it doesn't go on a pump. You start slow just like everything else, and then you can run it in as fast as they tolerate. Okay? Next is the FFP tubing. This is the tubing for FFPs. FFPs can go by gravity or on a pump, so we use this kind of tubing here on our Horizon pumps. And we start slow and then as fast as they can tolerate, okay? This is also our red blood cells tubing that we use. We start slow, and then our policy at Valley Care states that we give it within 2 to 4 hours. So blood is not to hang longer than 4 hours, but not to be given faster than 2 hours. And a lot of times our doctors will specify infuse over 3 hours, so then we go by that. But if they do not specify or write specifically on their order, then it's between the 2 to 4 hour range. Okay? Another thing to remember is that we change the IV tubing every 2 units or every 24 hours to make sure that we don't have any risk of infection, okay? Couple other tubing sets that we have here at Valley Care. This is a rapid blood infusion tubing. Here it has this pumping syringe that we can pump blood in really fast in case of an emergency, most often seen in the OR or ICU after heart surgery, okay? This here is another blood. The tubing is not here, but the important thing here is the filter and the bag. It comes with surgical patients that we have here at Valley Care. This is for orthopaths when we're processing the patient's own blood and then giving it back to them. So the important thing to know is that we always want to have this filter, and then we just use the regular IV tubing. Doesn't go on a pump. It goes as fast as the patient can tolerate, okay? And then the last tubing here we have is a blood warmer. This is only seen in the ICU as well. it inserts into this little machine that warms the blood so that if it needs to be given really fast, the cold blood that comes from the lab isn't shocking the patient because it's so cold being given so fast. So that is that. And thank you again for listening to the blood administration information. Thank you very much.